Have you ever woken up in the middle of the night, needing to visit the bathroom more frequently than before? If you've noticed changes in your urination habits, it could be a sign that your body is trying to tell you something important. Many people assume that frequent trips to the bathroom, difficulty urinating, or feeling like the bladder isn't completely empty are just a natural part of aging. But in reality, these symptoms can be early indicators of more serious health issues that shouldn't be ignored. In this video, we'll explore how your urination habits can provide crucial insights into your overall health and why paying attention to these changes is essential. Ignoring them can lead to complications that impact not only your urinary system, but also your kidneys, heart, and overall well-being. We'll also discuss 4 common habits that could be harming your urinary health without you realizing it and practical steps you can take to protect yourself. Urinary health plays a major role in determining longevity and quality of life, especially as we age. Conditions like an enlarged prostate in men, weakened pelvic muscles in women, or underlying issues like diabetes, kidney disease, and infections often reveal themselves through subtle changes in bathroom habits. The good news is that by understanding what's normal and what's not, you can take action early to prevent more serious problems down the road. If you're dealing with frequent urination, difficulty emptying your bladder, or simply want to learn how to maintain optimal urinary health as you get older, this video is for you. By watching until the end, you will discover key insights that can help you avoid common mistakes, take better care of your bladder, and improve your overall well-being. Maintaining a healthy urinary system is about more than just avoiding discomfort. It's about protecting vital organs, ensuring proper hydration, and making lifestyle adjustments that can significantly impact your long-term health. Many people ignore urinary symptoms until they become severe, but being proactive can make all the difference. Understanding what your body is telling you and knowing when to take action is a first step toward better health. Before we dive in, take a moment to subscribe to this channel and turn on notifications so you don't miss future health updates. Your support allows us to continue bringing you valuable information that can help improve your daily life. If you find this video helpful, don't forget to hit the like button and share it with someone who might benefit from it. Now, let's get started. Why urinary health matters more than you think. Most people don't think much about urination beyond it being a routine bodily function. But in reality, the way you urinate, how often you go, and any changes in your habits can tell a lot about your overall health. Urination is your body's way of eliminating toxins, maintaining fluid balance, and ensuring that your kidneys are functioning properly. Any disruptions in this process can indicate an underlying issue that needs attention. For instance, frequent nighttime urination, waking up multiple times to use the bathroom, can be an early warning sign of diabetes, kidney disease, or even heart problems. If your body is struggling to regulate fluid levels, it could be compensating by producing more urine at night. This condition, known as nocturia, is often dismissed as a minor inconvenience, but it can have significant health implications if left unchecked. Another common but overlooked issue is difficulty emptying the bladder completely. If you frequently feel like you still need to go even after using the bathroom, it could be due to an enlarged prostate in men or weakened pelvic floor muscles in women. Over time, this can lead to urinary retention, increasing the risk of infections, bladder stones, and kidney problems. Ignoring these signs can have long-term consequences. Chronic urinary issues are not just about discomfort. They can lead to serious complications like urinary tract infections, kidney disease, and reduced bladder control. Recognizing early warning signs can help you take preventive measures before these issues escalate. 4 common habits that may be harming your urinary health. Many people unknowingly engage in daily habits that put unnecessary strain on their urinary system. These habits may seem harmless at first, but over time, they can contribute to worsening bladder control, infections, and other health problems. 1. Holding in urine for too long. One of the most common yet harmful habits is delaying bathroom trips when you feel the urge to urinate. Many people hold in urine because they are busy, don't have access to a restroom, or think it's not urgent. However, consistently holding in urine can stretch the bladder, weaken its muscles, and increase the risk of urinary retention and infections. Your bladder is designed to hold a limited amount of urine, and when you ignore signals to empty it, bacteria can multiply, leading to infections. Over time, this habit can contribute to loss of bladder control, making it harder to urinate normally as you age. 2. Not drinking enough water. Dehydration is another common issue that negatively affects urinary health. When you don't drink enough water, your urine becomes more concentrated, which can irritate the bladder lining and increase the risk of infections and kidney stones. Dark yellow or strong-smelling urine is often a sign that your body needs more hydration. Many older adults reduce water intake to avoid frequent trips to the bathroom, but this could do more harm than good. Proper hydration helps flush out bacteria and toxins, keeping your urinary system healthy. The key is to find a balance, staying hydrated without overloading your bladder at once. 3. Consuming too much caffeine and alcohol. Caffeinated drinks like coffee, tea, and sodas, along with alcoholic beverages, act as diuretics, increasing urine production and irritating the bladder. If you find yourself going to the bathroom too often or experiencing urgency, reducing caffeine and alcohol intake can help. These substances can also contribute to bladder inflammation, making urinary symptoms worse. For those struggling with frequent nighttime urination, limiting fluid intake in the evening and cutting back on caffeine or alcohol can significantly reduce disruptions in sleep. 4. Ignoring changes in urinary habits. Many people overlook small changes in their urination patterns until they become major problems. Symptoms like a weak urine stream, frequent urges to go, or pain during urination should not be ignored. These could be early signs of underlying conditions, such as an enlarged prostate, bladder dysfunction, or even infections. Regular health checkups, including urinalysis and prostate screenings for men, can help detect issues before they become serious. Taking action early can prevent complications and improve overall well-being. What's next? Now that you understand the importance of urinary health and common habits that might be harming your bladder, the next step is learning how to strengthen and protect your urinary system. In the next part, we'll explore practical solutions, including dietary changes, exercises, and medical options that can improve bladder control and overall urinary health. By making small but meaningful adjustments in your daily routine, you can reduce your risk of developing serious urinary issues and maintain a healthier, more comfortable lifestyle as you age. Strengthening and protecting your urinary health. Taking care of your urinary system is essential for maintaining a healthy and active lifestyle as you age. In this section, we will explore practical strategies that can help strengthen your bladder, prevent common urinary issues, and improve your overall well-being. By making small adjustments to your daily routine, you can significantly reduce the risk of complications and enjoy better urinary health. If you experience frequent urination, difficulty emptying your bladder, or discomfort while urinating, implementing these strategies can help restore balance and prevent further complications. Let's take a closer look at the key steps you can take to support a healthy urinary system. 1. Staying hydrated the right way. Proper hydration plays a crucial role in maintaining urinary health. While drinking enough water is essential, excessive fluid intake, especially before bedtime, can contribute to frequent nighttime urination. The key is to find the right balance, ensuring you drink enough water throughout the day while adjusting your intake in the evening to reduce disruptions in sleep. Dehydration can lead to concentrated urine, which may irritate the bladder and increase the risk of infections. A good rule of thumb is to monitor the color of your urine. Pale yellow urine indicates good hydration, while dark yellow or strong-smelling urine suggests that your body needs more fluids. It's also important to be mindful of beverages that can negatively impact urinary health. Caffeinated drinks, such as coffee, tea, and sodas, as well as alcoholic beverages, act as diuretics, increasing urine production and irritating the bladder. Reducing or eliminating these drinks can help improve bladder function and reduce urinary urgency. 2. Strengthening the bladder with pelvic floor exercises. Weak pelvic floor muscles can contribute to urinary incontinence and difficulty controlling urination. Strengthening these muscles through targeted exercises can improve bladder control and reduce the likelihood of leaks or sudden urges to urinate. Kegel exercises are one of the most effective ways to strengthen the pelvic floor. These exercises involve contracting and relaxing the muscles that support the bladder. To perform Kegel exercises correctly, Identify the pelvic floor muscles by stopping urine flow midstream. Once you locate the muscles, practice contracting them for 5 seconds, then relax for 5 seconds. Repeat this process 10 to 15 times, 3 times a day. Regular pelvic floor exercises can help both men and women maintain better bladder control, especially as they age. In addition to Kegels, low-impact exercises, such as yoga and Pilates, can also strengthen core muscles that support bladder function. 3. Maintaining a healthy diet for optimal urinary health. What you eat plays a significant role in bladder health. Certain foods can irritate the bladder, while others provide essential nutrients that support urinary function. Including more bladder-friendly foods in your diet can help reduce irritation and promote overall well-being. Foods that support urinary health include water-rich fruits and vegetables. Cucumbers, watermelon, and celery help maintain hydration and flush out toxins from the body. Foods high in fiber. Whole grains, leafy greens, and legumes prevent constipation, which can put pressure on the bladder. Probiotic-rich foods, yogurt and fermented foods help maintain a healthy balance of bacteria in the urinary tract, reducing the risk of infections. On the other hand, certain foods and beverages should be avoided to prevent bladder irritation. Spicy foods, acidic fruits, artificial sweeteners, and processed foods can all contribute to increased urinary urgency and discomfort. By making simple dietary adjustments, you can support a healthier bladder and reduce the risk of developing urinary problems. 4. Seeking medical advice when needed. If you notice persistent changes in your urination habits, it's important to consult a healthcare professional. Symptoms such as blood in the urine, sudden pain while urinating, or frequent nighttime urination should not be ignored. These signs could indicate underlying conditions that require medical attention. Routine checkups and preventive screenings, such as urinalysis or prostate exams for men, can help detect issues early and provide guidance on maintaining urinary health. Taking proactive steps now can prevent more serious complications in the future. What's next? Now that you understand the importance of hydration, diet, exercise, and proper bathroom habits in maintaining urinary health, the next step is exploring treatment options for common urinary issues. In the next part, we'll discuss medications, natural remedies, and lifestyle modifications that can help manage conditions such as an overactive bladder, urinary incontinence, and prostate-related problems. By taking these simple yet effective steps, you can improve your bladder health and prevent long-term complications. Remember, small changes in your daily routine can have a big impact on your overall well-being. Treatment options for common urinary issues. Urinary problems can significantly impact daily life, but the good news is that many of these issues can be managed or even prevented with the right approach. In this section, we'll explore different treatment options for common urinary problems, including medications, natural remedies, and lifestyle changes. Whether you're dealing with frequent urination, an overactive bladder, incontinence, or prostate-related issues, there are effective ways to regain control and improve your quality of life. Understanding these options will help you take proactive steps to protect your urinary health and prevent complications. Let's dive into the best solutions available today. 1. Medications for urinary health. For many people experiencing urinary problems, medications can be an effective way to manage symptoms and improve bladder control. Depending on the condition, different types of medications may be prescribed. For overactive bladder and urinary urgency, anticholinergic drugs such as oxybutynin, toltrodine, and solifenacin help relax bladder muscles, reducing the urge to urinate frequently. Beta-3 adrenergic agonists like mirabegron help increase bladder capacity, allowing for better control over urination. For enlarged prostate in men, alpha blockers, such as tamsulosin and doxazosin, help relax prostate and bladder muscles, making urination easier. 5-alpha reductase inhibitors, like finasteride and dutasteride, help shrink and enlarge prostate over time, reducing urinary symptoms. For urinary tract infections, UTIs, antibiotics are the primary treatment for UTIs, helping to eliminate bacterial infections and relieve discomfort. Pain relievers like phenazopyridine can be used temporarily to ease burning sensations while urinating. Before taking any medication, it's essential to consult a healthcare professional to determine the right treatment based on individual needs and medical history. 2. Natural remedies and supplements. For those looking for alternative or complementary treatments, natural remedies and supplements can help support urinary health. While they may not replace medical treatments, they can be effective in preventing or managing mild symptoms. For urinary tract infections, cranberry extract is known to help prevent bacteria from sticking to the urinary tract, reducing the risk of infections. D-mannose, a type of natural sugar, may help flush out bacteria from the bladder and prevent recurrent UTIs. For overactive bladder and incontinence, pumpkin seed extract has been found to improve bladder function and reduce symptoms of overactive bladder. Magnesium-rich foods, such as nuts, leafy greens, and whole grains, can help relax bladder muscles and reduce urinary urgency. For prostate health in men, saw palmetto supplements are commonly used to help reduce symptoms of an enlarged prostate and improve urine flow. Zinc and selenium are essential minerals that support prostate health and may help prevent inflammation. While these remedies can be beneficial, they should be used in combination with other treatments and under the guidance of a healthcare provider. 3. Bladder training and behavioral therapy. For those experiencing frequent urination or incontinence, bladder training techniques can help regain control and reduce the number of trips to the bathroom. Techniques for bladder training. Scheduled bathroom visits. Instead of waiting for the urge to urinate, setting a regular schedule for bathroom breaks can help retrain the bladder to hold urine longer. Delayed urination technique. Gradually increasing the time between bathroom visits can strengthen bladder control and improve capacity. Double voiding. Urinating twice with a short break in between can help fully empty the bladder and prevent frequent urges. These techniques, combined with pelvic floor exercises like Kegels, can improve bladder control and reduce incontinence over time. For dietary and lifestyle modifications, making simple lifestyle changes can have a significant impact on urinary health. Certain foods and habits contribute to bladder irritation, while others help improve function and prevent discomfort. Foods to avoid. Caffeinated drinks, coffee, tea, soda, and alcohol can increase urine production and worsen bladder irritation. Spicy foods and acidic fruits, such as oranges and tomatoes, can trigger bladder sensitivity and increase urgency. Artificial sweeteners found in diet sodas and sugar substitutes may contribute to bladder irritation. Foods to include. Water-rich foods like cucumbers, watermelon, and celery help maintain hydration and flush out toxins. High-fiber foods such as whole grains, beans, and vegetables help prevent constipation, which can put pressure on the bladder. Lean proteins and healthy fats support overall body function, including urinary health. Maintaining a balanced diet and staying hydrated can help prevent many common urinary issues and promote long-term health. Long-term strategies for maintaining urinary health. Maintaining a healthy urinary system isn't just about treating existing issues. It's about taking proactive steps to ensure long-term bladder and kidney health. By making small but consistent changes in daily habits, you can prevent many common urinary problems and support overall well-being as you age. In this final section, we'll explore practical strategies that can help you maintain strong bladder function, prevent infections, and reduce the risk of complications. These tips will help you take control of your urinary health and enjoy a better quality of life. 1. Establishing a healthy daily routine. Creating a daily routine that supports bladder health can make a significant difference in preventing urinary issues. Some key habits to incorporate include sticking to a regular bathroom schedule. Going to the restroom at consistent times during the day helps train the bladder to empty fully and reduces urgency. Avoiding late-night fluid intake. Drinking excessive fluids before bed can contribute to frequent nighttime urination, nocturia. Limiting fluids in the evening can help promote uninterrupted sleep. Choosing the right beverages. Water should be your primary source of hydration, while limiting caffeine, alcohol, and sugary drinks can help prevent bladder irritation. By being mindful of these habits, you can support a more balanced and healthy urinary system. 2. Maintaining proper hydration. Drinking enough water is essential for kidney function and bladder health, but excessive fluid intake can also contribute to frequent urination. The key is to drink moderate amounts throughout the day rather than consuming large amounts at once. Tips for proper hydration. Aim for 6 to 8 glasses of water per day, depending on your activity level and climate. Drink more water earlier in the day and reduce fluid intake in the evening to avoid nighttime disruptions. Monitor urine color. Pale yellow indicates good hydration, while dark yellow suggests dehydration. Proper hydration helps flush out toxins, reduce the risk of infections, and keep the urinary system functioning efficiently. 3. Strengthening bladder muscles. Bladder control naturally weakens with age, but simple exercises can help strengthen the pelvic floor muscles and improve bladder function. Kegel exercises. Identify the pelvic floor muscles by stopping urine midstream. Contract and hold these muscles for 5 seconds, then relax for 5 seconds. Repeat this 10 to 15 times, 3 times per day for better bladder control. Incorporating low-impact activities, such as walking, yoga, or Pilates can also support pelvic health and reduce bladder pressure. 4. Managing weight and physical activity. Excess weight puts added pressure on the bladder, increasing the risk of urinary incontinence and urgency. Maintaining a healthy weight through a balanced diet and regular exercise can help reduce this pressure and improve bladder function. Ways to maintain a healthy weight. Engage in moderate exercise for at least 30 minutes a day, walking, swimming, or stretching. Follow a fiber-rich diet to prevent constipation, which can worsen bladder problems. Avoid processed foods and excess salt, which can contribute to water retention and bloating. A healthy lifestyle promotes overall well-being and reduces the strain on the urinary system. 5. Preventing urinary tract infections, UTIs. UTIs are one of the most common urinary health issues, especially among older adults. Preventing infections requires a combination of hygiene, hydration, and dietary choices. Tips to prevent UTIs. Drink plenty of water to flush out bacteria before they cause an infection. Urinate after intercourse to reduce bacteria entering the urinary tract. Avoid irritating products like scented soaps, powders, and bubble baths that can disrupt the natural balance of the urinary tract. Taking these preventive measures can reduce the risk of infections and promote overall bladder health. 6. Regular health checkups and screenings. Routine medical checkups are essential for detecting urinary issues early and preventing complications. Many urinary problems develop gradually, making regular screenings an important part of long-term health. Key medical tests to consider. Urinalysis helps detect infections, kidney problems, and other underlying conditions. Prostate exams for men over 50 identifies prostate enlargement or other issues affecting urination. Bladder function tests assess urinary control and bladder capacity, especially for those with incontinence issues. Discussing any changes in urination habits with a doctor can lead to early detection and timely treatment of potential concerns. 7. Adjusting lifestyle choices for long-term health. Making a few adjustments to daily habits can go a long way in supporting urinary health for years to come. These lifestyle changes can help reduce the risk of bladder problems and improve overall well-being. Long-term strategies for urinary health. Quit smoking. Smoking increases the risk of bladder cancer and weakens bladder control. Limit alcohol and caffeine intake. Both can overstimulate the bladder and contribute to frequent urination. Prioritize hydration without overloading the bladder. Drink water consistently, but avoid excess fluid intake in the evening. By adopting these lifestyle changes, you can maintain a strong and healthy urinary system well into your later years. Final thoughts. Taking control of your urinary health. Urinary health is a crucial aspect of overall well-being that often gets overlooked. Small changes in daily habits, diet, and hydration can make a big difference in preventing common urinary issues and improving bladder control. By following the strategies outlined in this video, staying hydrated, exercising regularly, maintaining a balanced diet, and practicing good bathroom habits, you can take proactive steps toward better urinary health. Preventive care, regular checkups, and a commitment to healthy lifestyle choices can ensure long-term comfort and improve quality of life. Don't forget to like, share, and subscribe for more health-related content. Your support allows us to continue providing valuable information to help you live a healthier, happier life.